Hi guys, this is Counselor Wise speaking. Welcome to Counselor Wise's Corner. Class is officially in session. So today we're going to be talking about mental health, particularly here in the beautiful island of Jamaica. Now I know that previously the whole idea of mental health was taboo, but we are improving that area, I would like to think. It's now gaining traction, it's gaining acceptance. More and more Jamaicans are thinking about mental health. So even though we're not quite there as yet, at least we are making progress, right? So why it is that we need to be talking about mental health? What's the point of it? Well, the truth is, when we talk about mental health, we tend to reduce the stigma surrounding mental health. You know, when we talk about mental health, back in the days, person was like, I don't have mental health. Hello, we all have mental health. And that's because persons never really understood what the whole idea of mental health was. So just by talking about it, people get a better understanding of what it is about. When we talk about mental health, we are able to find out ourselves, what our mental state is. We need to know what our mental state is because when we know what our mental state is, we can get help if we need help. We need to be able to recognize the things that negatively affect our mental health, and we also want to know the things that help to boost our mental health, right? And also, when we're able to recognize the signs and symptoms, we can help others who may be having mental health challenges to get help if they need to get help. Alright, so those are the important reasons why we need to be talking about mental health. Especially because Jamaica is a stressful place to live in, very stressful. And stress is a major factor that affects a person's mental health. So we need to know what our mental state is here in Jamaica and how we can pretty much keep our mental health in a good place. So that's why we're talking about mental health today. It's almost fun. So let us look at what exactly we'll be talking about today, because we will have a series of videos speaking about mental health. But for this video, we're going to be focusing on what is mental health and the mental health literacy pyramid. So, what is mental health? Well, according to the World Health Organization, WHO, mental health refers to a state of emotional, psychological, and social well-being. Alright, so the emotional speaks to how we're feeling, the psychological speaks to our thoughts, and the social speaks to how we interact with others. So that's what mental health is in a nutshell. And really and truly, when it comes down to it, mental health affects how we think, how we feel, and how we act. In another video, I will explain for you how what we think affects how we feel and how we act. So let's move on to the mental health literacy pyramid. So as you can see on your screen, the mental health literacy pyramid is structured in the form of a triangle. Alright, so at the base of the triangle you will see no distress, problem, disorder. Above that you will see mental distress. Above that you will see mental health problem, and then at the top, very top of the triangle, you will see mental disorder slash illness. Now, what this is saying in essence is that there are levels to mental health. So guys, yes, Jamaicans particularly, you don't just, there's not just two states of mental health. You're not just sane and insane, okay? Or what we call mad. There are actually levels to our mental health. And What I also want to point out here is that most persons will experience low distress, problem or disorder, mental distress, mental health problem at one point or the other. You will experience all of these. Do you realize that at the very top of a triangle where you have mental disorders, only a few persons from our society would actually get to the point of experiencing mental disorder or mental illness. But everybody else would fall in the other three. Alright, let us talk about a low distress problem or disorder level of mental health. So here we go. At this level, most persons tend to be unbothered, as it says, experiencing no stress at all. At this level, your feelings tend to be content, happy, relaxed, chill. So you know it's a good space to be in. As a matter of fact, I think everybody strives for this state, right? Everybody. Who does not want to be in a state of no distress? So what situations that normally facilitate these emotions? Alright, let's look at it. One of them could be you just hanging out with your friends, whatever you do for fun with your friends. Maybe go to a party, maybe go to the beach, go for a drink, whatever. It could involve you just doing something that you love. Could be by yourself, could be with somebody that you love as well. Just doing something that you love that helps to relax you, that makes you feel good. Sum it all up at this stage of your mental health, you are having a great day. You know those days when all is right with your world, ain't nobody bothering you, or even if it's not the entire day, a section of the day, yeah, that is the state that most of us want to be. All day or all our lives if possible. So that is the state of no distress, all is right with your world, even for a few hours, and you're just doing you, relaxing, being happy, being content, just chill. Now we move on one step up on the mental health pyramid and we get to the mental distress. So for mental distress at this level of the mental health pyramid, it's still normal in the sense that whatever you're experiencing at this level really comes from day-to-day stressors. So it's our body's normal response to the day-to-day stressors experiencing, right? So our feelings at this level could be of sadness, nervousness, disappointment, irritation, depending again on what is happening with you. Alright, so what situations could cause these emotions or some of these emotions? For example, if you're going to school and you are going to do what next, you have an exam coming up. You know that anxious feeling that you may get, or that nervous feeling that you may get in anticipation of that upcoming exam or test, that could be classified as you experiencing mental distress. Right? So it's really our day-to-day stressors that brings on this feeling of mental distress. Another example, maybe going to the embassy. How many of us go to the American embassy to get a visa? That emotion that you feel, that anxiety, that thoughts that you may or may not get through for that interview, maybe for that job interview as well that you want to get. That emotion that comes on is what we classify as mental distress. So you're no longer feeling no distress, so you're no longer at the bottom of the pyramid, but you are a little agitated mentally, and so you are experiencing mental distress. Now, having a mental distress does not mean that you have poor mental health. It just means that there is some disturbances going on right now, and usually that feeling tends to go away as soon as the situation is resolved or as soon as you're able to deal with the situation. Or it may persist depending on the outcome. So I'm hoping that you're getting the idea and you're getting a better understanding of what mental health looks like. So now we're going to be looking at mental health problem. As you move up the mental health pyramid, you will see that it gets a bit more technical and mental health becomes a bit more complex and even a bit more affected. Alright, so mental health problem. At this level, it's more than just the regular day-to-day stressors. Mental health problem really speaks to some major changes in our lives, usually negative changes. Things that come at this level include feelings of devastation, sorrow, hopelessness. Now, this is just my opinion. I really think that a lot of Jamaicans are at this level. A lot. Because it's just a stressful society to live in, and so many negative things are happening around us and to us. I really feel like a lot of Jamaicans are experiencing this as we speak. We're at this level of the pyramid, right? So, what are some situations that could cause these emotions, these major emotions, to affect our mental health? Number one, death of a loved one. You see why I said that I think that most Jamaicans are at this point as we speak? Because people are just dying left, right, and center. You know, like people are just losing loved ones and plunged into grief. And it's not just about persons being sick, it's about people just being killed or these accidents on the road, but just the loss of life in such a traumatic way really and truly triggers our mental state and causes us to experience a mental health problem. So even though, let me just clarify guys, that even though you may be experiencing a mental health problem, it does not mean that you have a mental disorder. You are still not at the top of the pyramid as yet. Okay? Just to point that out. But it really affects our ability to function mentally. And so it's really significant. And at this level, oftentimes we need help to get through this. Because if it's not resolved, then our mental health can deteriorate. Right? So yes, another example of a situation that can plunge us into having mental health problems is a diagnosis of a chronic or terminal illness. Just hearing that, for example, God forbid, you may have cancer or you may have some other terminal illness. That can really put a person in a state of mental health problem. Loss of life savings, losing your money, your savings to scamming or whatever means can really plunge a person into a state of mental health problems. So as I said before, these are life-changing events that can really affect one's ability to function emotionally, psychologically, and socially. So at this level, help is usually required because it's hard to navigate your life, to function normally when these major events are happening. And so at this level, it's good to perhaps talk to somebody that you can trust, or it may be good to to see a counselor or a therapist, a professional, somebody who will be able to give you some tools, some coping tools to go through that particular season of your life. Because what we don't want to happen is that your mental health deteriorates because of these circumstances, these very difficult circumstances. Now we move on to mental disorder. For a person to be considered to have a mental disorder, they have to be diagnosed by a medical professional. Alright, they have to be diagnosed by a doctor. We love, as Jamaicans, we love to say, boy, that person is mad. But the truth is, in order for a person to be considered to have a mental disorder, they have to be diagnosed by a medical professional, whether the psychiatrist, the clinical psychologist. Alright? So mental disorders are really disturbance in the brain functioning. And I emphasize this because Jamaicans tend to think that when they see a person with some kind of emotional disturbance, oh, they're just weak, or they are not strong enough mentally. That tends to be the attitude. Guys, mental disorders are more than persons' emotional strength or mental strength. It's a disturbance in the brain functioning. Alright? So just like how persons have physical illnesses, there's some disturbance in the functioning of the heart or the kidney or the liver and so forth. Mental disorders are disturbances in brain functioning. So for example, major depressive disorders, post-traumatic stress disorders, general anxiety disorders, and support are all considered mental illnesses that need to be diagnosed by a doctor. So for mental disorder at this level of the pyramid, as you can see, it's very small, so not everybody will have a mental disorder, but when a person does have a mental disorder, needs medical intervention and treatment. When a person has a mental disorder, it needs medical intervention and treatment. I have to say it twice because persons tend to think that you can do other things to treat with mental disorders. And the person who has a mental disorder tends to suffer for longer than they need to because persons don't understand that it's a disturbance in the brain functioning and it needs medical intervention and treatment. Now, that intervention or treatment could include both medication and talk therapy, or one or the other, depending on the situation. So guys, we are going to wrap up shortly, but I want to leave you with important factors to take note of. Number one, not because you are experiencing mental distress, a mental health problem, or a mental disorder means that you automatically have poor mental health. No guys, that's not the case. What I mean by that? A person with mental distress, as I said before, is really short-term our body's normal response to stress. Once we deal with that situation that is causing the mental distress, usually we go back to being good. It does not give us poor mental health. For the mental health problem, a person who is experiencing a mental health problem or a mental disorder does not necessarily have to have poor mental health either. How is this possible? So once healthy coping skills are employed, those coping skills will help to alleviate a deterioration of their mental health. So they may be experiencing mental health problems, but not poor mental health. The same thing for a person with a mental disorder. They don't necessarily have to have a poor mental health. Why? They are taking their medications, they are getting treatment, they are taking care of themselves, and just by doing that, they experience good mental health. Alright, guys, so that is all the time we have today. But before you go, I would like you to take a moment to comment. Where do you think you are on the mental health pyramid right now? Thank you for taking the time to watch this video. I'm going to ask you guys to share the video so that somebody who needs to know about mental health can be informed today. Thank you very much once again and have a blessed one.